know they see her for market. A good woman is a blessing from above. Her type will not there for market. I tell you more, Yaku. When you batra kolisa seva, you know more, those Yaku. When you batra those Yaku. Always loving everybody, no discrimination. What I did, man, no competition. Blessings of the Lord. A good woman no come from the Lord.
We want to move on to the high point of this opening ceremony. Our keynote address, collaboration and innovation to build local solutions for the future of Nigeria pharmaceutical industry. We have an eminent and distinguished personality to deliver that keynote in the person of Dr. Henrrrita Ukwu, who is a fellow of the American College of Physicians. She is also a fellow of the Regulatory Affairs Professional Society. Join me and the upstanding as we welcome to deliver the keynote address at the 29th Annual National Conference at the Association of Industrial Pharmacists, Dr. Henrrrita Ukwu, the FACP FRAPS. A round of applause as they enter.
Dr. Henrrrita Ukwu is a physician, infectious diseases expert, professor, pharmaceutical industry executive, thought leader, and author of the landmark textbook Global Regulatory Systems, a strategic primer for biopharmaceutical product development and registration, and self-development leadership book, ABCs of Leadership Guiding Principles. She's an award-winning inspirational leader who has won prestigious Pharma Voice and Topper Awards for inspirational leadership and is a legacy leader. She's known to create high-performing global teams and transform existing teams to drive top-line results and tangible bottom-line outcomes with engagement. She is one of the pioneer professors at Temple University Quality Assurance and Regulatory Affairs Graduate Program. She was named one of the top blacks in healthcare in 2019 and named to Marquis Who's Who in America in 2026. Dr. Henrrrita Ukwu is currently Executive Vice President, Chief Regulatory Officer, Novavax Incorporated, which she joined in 2021 as SVP, Chief Regulatory and Global Quality Officer, a position she also held at Otsuka Pharmaceutical Company. In the current executive role, Dr. Ukwu has overseen the phenomenal race to COVID vaccine for the pandemic and achieved the numerous emergency use authorizations for the Novavax vaccine across the globe and continues for the race to the COVID variant vaccine for the fall campaign. She has over 2 decades of executive pharma industry leadership, including at Merck, Pfizer, PPD, Otsuka, Novavax, where she held Vice President and Senior Vice President and Executive Vice President positions, leading global regulatory and global quality teams. She's a strategic and agile leader recognized for her inspirational solutions and results-driven leadership, Dr. Ukwu has effectively and successfully led global regulatory organizations for over 300 employees with significant annual operating budget, driving operational and organizational excellence, building and transforming teams, delivering solid, impactful results with top and outstanding team performance. Ladies and gentlemen, it's my pleasure to present to you Dr. Henrrrita Ukwu.
Wow. Thank you very much, NAIP, for this mega conference. We thank God, for this is to His glory, bringing us all together to explore the theme and drive forward to achieve the results of the theme of this conference. I stand here with all protocols observed, with deep respect for our respected and distinguished guests, and recognizing all that have traveled from far and near to be here. Thank you for inviting me, Chairman NAIP, Sir Bankole, and as has already been identified, he's one of the unique individuals that bears the names of the key regions of Nigeria, a true Nigerian citizen, because he has Bankole, he has an Hausa name, he has an Igbo name, so he's a true representative. Thank you very much for extending this invitation. I am very honored and humbled. I think Naib and Sir Bankole should be given the award for incredible PR, because as Chairman Badu said earlier, I have nothing to do with this. So they must have gone through quite a bit on social media to achieve this and put together a wonderful introduction for all of the speakers so far and for my humble self. So thank you all very much. I don't really know how to script my talk, nor do I know how to stand in one place. So pardon me if I move up and down, as long as my high heels don't get caught somewhere. The theme of this conference is huge. It really deserves a pause. I acknowledge and agree with many of the comments from all of the representatives so far, and especially Chairman Bakole's and Chairman Badu's comments. Because what we're trying to embark on is a tall order. But if we don't shoot for the sun, we wouldn't even make it to the moon. So it's important that our aspirations are high. And all of us that are in pharmaceutical medicine, which is what I choose to call it, know that we have what we call target product profiles, that are our aspirational goals, that eventually forms the bedrock for the product label, whatever is achieved post all the studies. So, driving to a future of the Nigerian pharmaceutical industry is a tall order, because it goes from end to end. And where we are now in Nigeria, we have different business models that we're pursuing. Some of our manufacturers have already started some local manufacturing of some of the essential products. I was having this conversation yesterday with Chairman Badu in the plane. We are making some anti-malarials, we're making some analgesics, we're making some antibiotics. However, the API continues to be sourced almost exclusively internationally. So, if we could go on to the next slide, please. So, for every major project, we have to have a problem statement. What are we trying to solve? What we're trying to solve is our extreme dependency of both our active pharmaceutical ingredients, the APIs, as well as the raw materials and most of what it is that we use for even those ones that we're manufacturing now. The other business model is production of generic products, that is, copies of innovator products. That is also ongoing. So usually with my teams and the people that I work with, I like to start with positive reinforcement, a positive recognition of what has been done, so that it gives us the energy to move into the next phase of what needs to still be done. Because we need to do a lot. This is a great objective. And I keep referring to the chairman's comments because he highlighted that in 2001. So about 20 years, let's put it that way, about 20 years ago, this has been an initiative on tables. It's been explored. So, getting back to, the two chairmen that I'll keep referring to, Chairman Badu and Chairman Bankole, because of their comments. And Chairman Bankole said, we don't just talk, we must walk the talk. We have highlighted this as a clarion call. There's a sense of urgency here, and I think the pandemic of the COVID helped us appreciate this incredible sense of urgency that we cannot continue to be dependent, because then we're vulnerable to volatilities of what happens elsewhere. Supply chains, medications, including our basic essential medications. So we have to do something. The whole world is waiting for Nigeria. I am so passionate about Nigeria. I don't even know whether we Nigerians understand what God gave us. We have all the resources. We have the population of over 200 million. We have incredible skills and skill sets. And what the Nigerians are doing in the diaspora. I've worked in pharmaceutical medicine for 35 years after my fellowship in infectious diseases. And there's so many of us in different aspects of pharmaceutical industry. And we are here in Nigeria, our own country, talking about rudimentary, basic. So the question is, what can we do to be a part of this solution? When Chairman Bankole approached me, I said the least I can do now, the least I can do is share the knowledge, train our team members, and be part of this solution. And I think we owe it to our country, every one of us, to do that. So let me focus on, I did actually present a talk, so let me focus on it a little bit. So you can see that a lot is happening. I like to use nuggets so that when people get up and leave, they remember something. Because we pour a lot of information and it's very hard to distill and walk away with something. So hopefully I don't have too many slides and we can go through them fairly quickly. This slide is one of the kind of slides I call a Six Sigma slide that has so much information in it without being crowded. So we start with the problem statement, and you can see that our federal government is doing something already about this. The Presidential Initiative for Unlocking the Healthcare Value Chain, the PVAC, and working with the, I think it's the Healthcare Federation of Nigeria, signing several agreements, working on waiving some of the policies that stifle investments, tariffs, etc. So those are being implemented. And we can see even from the recent launch of the Sun Pharmaceuticals, and I was hoping that the DG Adeye would be here because she's a fellow NAPSA member and the work that she's doing with NAFDAC. But that is a testament that things can actually progress forward. But what do we need to achieve this? If our goal is to establish local manufacturing here in Nigeria, what are the essential ingredients, the things that we must have? And I think if
if I engage the audience and walk down the steps, which I find difficulty with, so I'm not going to, and handed the podium to every one of you, I think you will list exactly what I have here. The first essential ingredient is sustainable technical capabilities and infrastructure for manufacturing and regulatory compliance for consistent high quality. There are two words you're going to hear me talk about a lot. Those two words are, I could even ask the audience, I think you can tell me what those two words would be. Sustainability and consistency. Think about it in everything we do and have done in Nigeria. Are we able to sustain and are we able to stay consistent in the quality? Because these are the tenets of manufacturing industry. The second is stable operating environment. Stable operating environment. How many times has the lights gone off in this conference? As one minimal example. How many times have we had disruption? You know, one of the things that stays stuck in my brain, and that was even when Nigeria was in better stead. So, when this light is so disruptive, how can you work with sterility of any kind? How can you work with storage? Cold rooms. Every one of us here is a pharmacist or a physician or works in this industry. We know what it means. So that's why I chose the word stable. It's not that we can't have intermittent, I'm talking about stable and consistent environment that allows for consistent power, water supplies, telecommunication. The third, which is so critical, again about sustainability and consistency, government ability to sustain political commitments and ensure regulatory efficiency. So think about it. We have PVAC, we have NAFTA, and these are all politically appointed positions. So when that government ceases and a new government comes, what happens? Everything of the previous government is abandoned and new initiatives are put in place. So what if the next government decides that this is not a priority and all of these efforts? Do they go to waste? Can they be sustained? Can they be moved forward? So some of these need to be at the tables where it matters, where the power sits, to be able to engage in a manner that is sustainable. Long-term, low-interest financing for the huge overhead costs. I'm trying to do a little business to continue my husband's legacy. And I am so overwhelmed. I don't even know how he did it. Because I tried to bring things from the US and pay in dollars to sell them in Nigerian naira. So my level is so, relatively speaking, so small, probably compared to many of you that have mega businesses and, you know, drug companies. So you import all of this stuff and you do what you can do here, and then you try to sell them and generate naira. When are you going to generate enough to cover the conversion rate of dollar to naira, to break even, let alone make profit and continue? So you can see why we need the government. We need commitment. So that, as Bakole said, we're not just talking, we can actually do something. You know, Nike says, just do it. That's their mantra. Just do it. Just get it done. Supportive fiscal policies and robust local procurement mandates. PVAC is obviously doing a lot with Medipool, looking at procurements. But again, it gets back to number 3. Would that be sustained? I'm usually very positive, and I hope this is being seen in a positive way. Right? So this afternoon we're going to talk about all of these. API, finance and policy, focus on innovation, government-led initiatives, PPs and collaboration. And I'd like to indicate that NAIP and your team, and under your leadership, Bankole, that you guys have chosen a very powerful theme, and you're already expressing collaboration by bringing all of us together and driving some training activities this afternoon and in the next few days. So you can see the value. Business impact. If we can achieve this, when we achieve this, Nigeria will be positioned as a regional hub. It's a major deal. Nelson Mandela, may his soul rest in peace, made a statement and said, Africa is waiting for Nigeria. That Africa will not rise until Nigeria takes its position that God has given it. And that is so true. Look around us. They're waiting for us. Fosters economic. So if we did this, we'll foster economic diversification to promote non-oil sectors, so that everything is not just around the oil. I'm sure some of us, I'm probably dating myself, so you can figure out my age in a minute, but some of us that were born before the war and immediately after the war, I still remember my geography book that used to identify the resources of Nigeria, from the pyramids of peanuts, hides and skin, rubber, cocoa, this, that, and the third. And then when my kids were in high school, elementary school, I was asked to come to give a talk about Nigeria in their school. And I was so blessed. It just fell. National Geographic just fell as I was walking into my husband's office. The Holy Spirit just sent that to me. Right in the middle, those were the days of, books, everything's online now. Right in the middle was the map of Africa. I just pulled it out, opened it, and it had all of the countries in Africa and their natural resources expressed with icons. Nigeria and South Africa were the most studied. Do you know what I mean? Studied. The only thing that was not there was diamond for Nigeria. And somebody said to me, if you look hard enough, you will find it in Nigeria. So we are so blessed. In fact, my husband would say we're over-blessed. We're suffering the disease of the over-blessed because we're not harnessing the one that we have. So you can see, this is the business impact when we achieve that. I don't want to say if, when we achieve this. And then we can establish the health security, because health is wealth. Without health, doesn't matter how much you have, it is meaningless. So if we go on to the next slide, and please, feel free to ask questions or engage so that I'm not just hearing my voice. I'm happy to stop and take any questions or comments. Can we get the next slide? Next slide, please. I was very happy when Bankole was going through his and realized that he uses the P letters. You can see that I wrote a book with ABCs. So I play around with words and letters. They're very powerful. They're really the backbone of language. So I have a 5-point agenda with P letter words. And Bankole had project, people, and process. I can't remember what the third P is, but so if you keep this in mind, you would at least be able to walk away from today's conference, because all of the speakers ahead of me have actually touched on all of these. So that way it's an easy way to remember what you heard, profile. So what would we look like when this is achieved, right? We would have a high quality pharmaceutical production. And what would it do? It would shift us from heavy international dependence. It would foster local product manufacture, and medicines can be available and affordable. What is the project? The project is a focus on manufacturing an active pharmaceutical ingredient. That is the project. So as we're trying to deal with this, what is our project plan? Because it's important to identify the project so that you can have a plan. And then what's involved? People and processes. Part of what we'll be doing today and maybe tomorrow and others is training. We've already identified the Empower project that the federal government Ministry of Health is driving to provide free training to the sector. Talent pool. I think I'm going to borrow your your signboard of hospitality. And the way you capture that because clearly we need the skilled talent pool for this activity. Performance and pricing, we've touched on financial issues, and there's a lot of overhead costs that's needed, that needs the attention of government and institutions of funding, and we're getting them. We are getting them. The European Union Investment Bank, the United States Pharmacopoeia's MedSure, which is Medicine Supply Resilience for Africa Initiative, funded by the UNITED, and then partnerships, lots of partnerships, and we'll get into that in a minute. But you can see the business impact when we achieve our agenda. Next slide, please. So could we just go back to the last slide, please? No, the one before this. Okay, so remember, number one, essential ingredients for success: sustainable technical capabilities, infrastructure for manufacturing, and regulatory compliance for consistent high quality. So now please go two slides ahead. The next one. So that is this. So do we have this? Do we have infrastructure and operational standards that emphasize GCP, current good practice of all types, not just the manufacturing laboratory, and then we'll talk about the clinical and safety pharmacovigilance. Quality management, so this is just regulatory and quality requirements. A quality management system, implementation of comprehensive systems of quality control, documentation and records with Part 11 compliance, personnel qualifications and safety training, facility standards and environment. You know, down to air flows. The way the air flows from one room to the other in the manufacturing facilities are all controlled. The way we gown, the equipments that we have, the qualification and validation of those equipments, sourcing of our APIs and raw materials and validating them, production operations, stringent quality controls, and then of course post-marketing surveillance. Are we doing harm? And then right there, I left it to the end, audits and inspection readiness. We will be inspected. We have to be audited. We have to have our own internal audits to prepare us for the external audits. And if we're doing this, we have to be ready for not only national inspections, but international inspections. So this has to be part of the book of work to get us ready as we embark on this crucial step for our national sovereignty and self-sufficiency. So if we go to the next slide. So this continues in terms of the requirements for pharmaceutical manufacturing company. So now if we're doing the branded innovative medications, discovery, and you know, whenever I think about target discovery, I think about our green chemistry, our herbal, the abundance of our herbal. My grandfather was called a traditional medicine man, and he took pride in the fact that he could even get the barren woman to conceive. It wasn't written, he didn't write it. You know, that's part of what we've lost in Africa in general, not writing a lot of the great things that have come ahead of us. But he would just go to I come from the eastern part of Nigeria, and it's like tropical vegetation. He knew all the leaves. He knew the leaves and the roots and which one would do what. I think we lost a little bit of that, even though we have some, like artemisinin and other leaves and our bitter leaf. There's so much. In fact, I used to dream that I would have a show on television that would actually help us appreciate the food that God has given us versus Western food that we try to eat that gets us sick. You know, my mom had sugar problems. It wasn't quite diabetes, it was pre-diabetes, and she started drinking bitter leaf water. And her HbA1c dropped from 6.3 to 5.4 and has stayed there with with bitter leaf water, right? So I'm so proud to know that some of our local manufacturing companies now are making the tablets or capsules of our bitter leaf. And you know, I realized the power of bitter leaf after going to China and all this hype about green tea, green tea. If you really think about green tea, it's our own bitter leaf. When you let it open up in your hot water, it's bitter leaf and it tastes like bitter leaf. You know, not the very bitter one. You know, you have to wash bitter leaf several times to get to something that you can actually drink. So there is so much that we have that I just wish, I hope and pray that we will begin to harness our own good. Because green chemistry is a huge potential for Nigeria. If we can establish the standards of efficacy, because we have to put them through clinical trials, we have to standardize the dose. Those people that give it to us right now could give you a gallon of water, of whatever it is, that could be turned, all of you pharmacists know, that can be turned into a high concentrate little tablet. That will be more efficacious. All right, next slide, please. So, I highlighted some companies in Nigeria. This is by no means exhaustive. So please, if you don't see your name here, don't feel offended. All of our manufacturing companies are recognized. I just picked a few to make a few points. You know, Chairman Bandu said that we will be 100 years next year. I'm sure many of you remember in the 60s, those of you that were born by then. But in the 60s and even into the 70s, a lot of the manufacturing companies were the foreign companies that had subsidiaries in Nigeria. And what they really had were drug reps that would distribute already finished products that were manufactured outside of Nigeria. But we've come a long way, because now we actually have our own manufacturing companies that are manufacturing certain essential medications, and we're looking to more. So we have Enzo leading the efforts around local API manufacture. So we have to applaud all of our manufacturing factories and our industrial pharmacists that are working to get us to a better place so that we can be self-sufficient. Next slide. So I chose to list some of the public-private partnerships. There are a good number of them, and many of them are getting funded. Some are getting funded within Nigeria, and others are getting funded outside of Nigeria. There are some government initiatives that are actually partnering with the European Union, the USB, Brazil, Memorandum of Understandings, etc. So this is a list of them. I don't know how much time I have for this, so I don't blow my whole time and the whole afternoon by walking us through what each of these initiatives are doing. But the PVAC is the main one, with the Healthcare Federation of Nigeria, supporting a lot of the policy changes and supporting a lot of the enhancement of API and really pushing this agenda, which is wonderful to have government mandate. The European Union and Nigeria have come together with a strategic investment. I think they hosted a meeting in October of last year, and that's how we came up with the enabling local manufacture for health, immunizations and nutrition. So it's called LNI or IN. I listed the NAIP Academy because they're really pushing this agenda. All of you here that are members and all of the sponsors and supporters pushing this agenda and driving training so that we can bridge the talent gap. MOU with Brazil, the International Finance Corporation, funding the FITSIN Healthcare to again continue to drive. All right, let's go on to the next slide, please. So I've mentioned a lot of this already in terms of innovative solutions and approaches. So the NAFDAC has put forward the 5+5 policy. So when they establish a license for a pharmaceutical company, before you renew for the next 5 years, you have to give them a blueprint of how you're going to transition to becoming a local manufacturer. So it's very similar to what the Indians did many years ago to ensure that you're transitioning from just total dependency to local manufacturing. I've highlighted green chemistry and the huge potential that we have in Nigeria. ENSO leading the effort for APIs, particularly for anti-malarials. And then of course, digitization, we're in artificial intelligence age that helps us with supply chain tracking, precision. And the next one, please. So on and so forth. Awareness building, I'd like to highlight the NAIP again. And then let's go to the last slide, since I have only 10 minutes. So, the challenges and the future outlook. I think we all know the challenges. We've mentioned many of them already. And then our future outlook, that those 5 ingredients that we started this conversation with need to be on the table of the decision makers and the power brokers where the money comes from, so that we can actually understand. I feel like I would like to draw a slide of end to end what is required from the very beginning to getting us the outcome that we need as a country. But I'd like to stop here, but before I finish, I'd like you to imagine this. Unfortunately, we do have counterfeits, but when I talk to my teams about quality, I say to them, you and I go to the market and you can decide which tomatoes you buy. You look at the market and say, oh no, I don't like this one, I'll change this tomato for that tomato, right? It doesn't have good quality. But we don't have that with medication. You get your prescription and you implicitly trust that it's going to do what it's going to. That is why the regulatory system has no tolerance for safety issues. With vaccine, one adverse event is one too many. You're a healthy person, you walk in and you get it and you get an adverse event. So let's keep that in mind as we think about the quality is immeasurable. We cannot compromise quality no matter what we do. And again, it's atrocious that we have as much counterfeit as we do, because innocent people go in trusting what they bought and then get even sicker from it. But let's end on a high note, and that high note is kudos to every one of you, kudos to the teams that are driving this, kudos to the partnerships that we have right now, and kudos to the spirit of can-do that we have as a country to continue to drive forward, and we will achieve results. Thank you.
On behalf of the Association of Industrial Pharmacists of Nigeria, NAIP, we would like to present this award to a very productive, hardworking, dedicated, excellent, intelligent keynote speaker, Dr. Henrrrita Ukwu. In recognition of your distinguished role as the keynote address speaker today at the 29th Annual National Conference training program of NAIP held at the Peace Hotel on the 5th of May, which happens to be the 49th birthday of NAIP. So, thanks so much, ma'am, for a very beautiful presentation. We wish you the very best. Okay, in honor of what she's done, we presented also a beautiful picture of her. We hope she will find a good place in our office or at home so that generations will see and remember the day that you came to honor us. We really honor you and we celebrate you highly. God bless you.
I am so grateful. I didn't expect anything. I am so grateful for this honor. Thank you. Thank you very much, everyone. Thank you. Thank you.
Is a blessing from above. Chotra no hioma. Akwanye chotra nesi wanye kwenwe no gono. You will find that a wife who will find it a good thing. So dear man, and obtain a favor from the Lord. You must see that blessings of the Lord. If you have a good woman, treat them well, value them well. No go take a love for granted to avoid a dino. If you lose a good woman, everything goes scatter. Everything go nyama. And so confusion. Wahala day. Honeymoon.